Okay, we have here spinal cord and its meningeal covering. No, the thick meningeal layer right there is the dura mater, and then let me show you the arachnoid. That is the arachnoid layer. It's a thin film-like layer, and the space below that is the subarachnoid space. In surgical patients, no, anesthetics can be injected, no, outside of the dura. That is called epidural anesthesia or epidural block. And then we can also inject, no, anesthetics or drugs in the subarachnoid space, no, subarachnoid block. We're looking at the posterior aspect of the spinal cord here. How do we know, no, this is posterior? One way, we can look at the cross section. Now, the spinal cord is, if I were to describe, no, I will describe this as it's shaped like a spade, no, spade. It's wider at the bottom and narrower here on the posterior aspect. Also, if you look at the there will be sulcus, no, and fissure, no, at the midline. Posteriorly, we have the posterior medial sulcus, no, which is narrower than the anterior midline fissure right here. No, it's deeper and wider. You can see, no, there's a somewhat wide sulcus visible right there. Fissure, I mean. Anterior median fissure. That will be the wider space, no, compared to the posterior median sulcus. No? And then another way, no, let me focus. Let me show you the posterior aspect here. You can see the this part, no, is mainly the posterior white matter column. You can see how prominent the posterior white matter column is, no? And lateral to the posterior white matter column will arise the posterior nerve roots of the spinal nerves, no? These nerve roots are sensory, by the way. And then this contains the lateral white column, no? Posterior white matter column, no? Then you have the posterior nerve roots, and then we have the lateral white matter column. Now, unlike in the brain where the white matter, no, is in the internal structure of the cortex, in the spinal cord, gray matter, white matter location is reversed, no? In the spinal cord, it's mainly white matter on the outside, gray matter on the inside. So try to examine this part, no? This is the anterior. This is the anterior aspect. You can see the anterior spinal artery running down the midline along the anterior median fissure right there, no? The anterior white matter column, no, is not as prominent, no, as the posterior white matter column back here, no? And then you can also see here the anterior nerve roots of the spinal nerves. That will be motor nerve roots or motor nerve fibers. No? As you can see, the nerve fibers, no, they are directed obliquely, slanted downward. So the nerve fibers does not exit, no, or leave the spinal cord perpendicular or horizontal to the long axis of the cord. At this level of the spinal cord, we can also see the cervical enlargement. No? The diameter, caliber, or the girth, no, of the spinal cord is not uniform throughout its length. It's wider at the cervical part, no? Narrow at the thoracic part, no? And then we have another area that is wide at the lumbar area. The cervical and lumbar enlargements are there because you have for the cervical enlargement, that is where the nerve fibers forming the brachial plexus, no, are attached. For the lumbar enlargement, no, that is where the lumbosacral lumbar nerve fibers will arise. So right here, this cone shape, no, terminal or distal part of the cord, that is called the conus medullaris. The tip, no, of the conus is at the upper border of L1. It reaches the upper border of L1. So the lumbar enlargement, no, the lumbar enlargement of the spinal cord, or the lumbar segment of the actual spinal cord, is still present, no, within the thoracic vertebral bones. And as you can see, the nerve fibers, no, arising from the lower thoracic and lumbar, they are more vertical, no, unlike the upper nerve fibers. They are more vertical because they will exit at the vertebral level, no, which is way below the actual level, no, where they arise in the spinal cord. So sometimes it gets confusing, no, to talk about the actual spinal cord levels, no, versus the vertebral levels, no. Lumbar segment of the cord, no, still occupy the thoracic vertebral bones, because remember, your spinal cord will end at the upper level or border of L1. So if we trace this further downward, no, there is a you can see a solitary fiber, no. This is purely white matter. It does not contain nerve fibers, no. This is the filum terminale, no? Filum terminale, that is mainly white matter material, no? And all this lumbar and sacral, no, nerve fibers, collectively we call this cauda equina, no? Cauda, tail, equina meaning horse, no? It looks like the tail of a horse, no? The cauda equina is mainly it's made up of lumbar and sacral spinal nerve fibers, no? Both sensory and motor, no, coming from posterior root. We have the sensory nerve fibers. Coming from anterior root, we have the motor nerve fibers, no? So this is posterior aspect of the cord.